Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Blood supply and also the derivatives, and this is the primitive gut. So what includes first is the foregut. So the foregut, it includes the celiac artery. So what about the celiac artery? The celiac artery is the lower esophagus to the duodenum. Lower esophagus to the duodenum. So this includes the pharynx, then comes the esophagus, then comes upper duodenum as well as the glands of the pharyngeal pouches. Glands of the pharyngeal pouches. So respiratory tract, liver and the gallbladder. Then comes the presence of the midgut. So what happens to the midgut? There is a superior mesenteric artery. SMA is superior mesenteric artery. So what is this role of the superior mesenteric artery? It supplies the lower duodenum and the jejunum ileum, the cecum, vermiform appendix. Then comes ascending colon, the proximal two-third of the transverse colon. Next is the hindgut. So hindgut is it includes IMA. IMA, it is the distal one-third of the transverse colon, and there is also the descending colon, the rectum, superior part of the anal canal as well as the urogenital sinus. To learn and grow daily like this, please do subscribe.